Shobhna Pradhan from Odisha. I would like to ask sir, how will we manage cases of focal adenomyotic changes who are having asynchronous endometrium growth in IUI cycles or IVF cycles?
Very difficult. Focal adenomyotic changes in the uterus, you're saying?
Yes, sir.
We normally don't bother about that. But when they are touching the endometrium and we are getting disruption of the endometrial myometrial junction, that's a time we have to worry. When the EMG is intact, we normally don't bother. When EMG is disrupted and you got small buds which come from it's called budding phenomena which occurs from the endometrium, that's a time we start reacting and taking more calls. In such a case, I think when you're doing for IUI, I don't know what to do because in IUI we can't down-regulate. Yes. But for IVF, yes, you can down-regulate the patient by giving her some lupride that will suppress adenomyosis, and then we can carry out the embryo transfer. So we give her the HRT after suppressing her endometrium, because we are trying to suppress endometrial myometrial junction which is getting disrupted. So give her lupride or depot of lupride or decapeptyl for some time, and then you start her cycle when she's taken around 10 to 12 injections of lupride or deca, then you will start her HRT with any estradiol. Okay. But you have to be very, very careful. These are tricky cases. Yes. But of course, to do carry out an hysteroscopy and see the extent of her adenomyosis and a 3D scan. On a 2D scan, how do you make out on a 2D scan that is adenomyosis?
Sir?
On a 2D scan, grayscale, how do you come to know that it is a case of adenomyosis?
Sir, the endomyometrial junction is disrupted.
Yes. What else?
Sir, myometrial cyst, sunray.
So, sunray appearance, global uterus, Venetian blind pattern,
yes.
And there can be lakes, blood, color Doppler. And yeah, it will look like a fan.
Yes.
There you'll come to know. Yeah, that's it. But do an hysteroscopy and give them down regulation.
Down regulate. Thank you, sir.